Good morning, everybody. Hope everybody can hear me. Just getting everything set up just real fast, and we'll give everybody just a little second to get on too. Hope everyone's having a good morning. It's very nice outside. Was looking at the pollen counts is quite high, so gives our talk a little more relevance today, so that's good. All right, guys, let's go ahead and just get started here. So today we're talking about seasonal allergies and their treatment options. Little back history for me. I had terrible allergies as a kid and struggled kind of into young adulthood too. I've done several rounds of allergy shots through my life. Really think that helped me as a kid. Had allergy shots from about 4 to 7, and then did allergy shots again when I was in high school, and I was a junior in high school. I've done all the different treatment rounds from antihistamines to decongestants to different supplement options. And so this is one that's really important to me. All right. So we're going to talk about environmental allergies and how they manifest, then our different treatment options. So in functional medicine, we like to use immunotherapy or allergy shots and drops in the attempt to get those symptoms to go away for a lifetime. We will talk a little bit about traditional medicines and then about some supplement options as well. If you guys have any questions through any of this, leave me a comment and I'll do my very best to get them answered for you. What are allergies? Allergies refer to a number of conditions. Typically what we'll see is our body has a hypersensitivity reaction to something that is typically harmless. So that's what we're thinking of: our pollens, our molds, our dust, our pets and other animals, certain foods and certain medications. What the body is doing, and this is not the only immune response that we have, but we'll see that it creates an IgE reaction or an immunoglobulin E reaction. This happens when an allergen binds to a receptor. So it binds to these mast cells and basophils, and then it causes that inflammatory release. And so that we get that big histamine release. What this looks like in diagnosis terms is our hay fever, our allergic rhinitis, eczema, our food allergies, asthma, and our most severe reactions are going to be anaphylaxis. Excuse me. Typically, when you think of seasonal allergies, those symptoms are your sneezing, runny nose, nasal congestion. We also have the itching of the eyes and the nose. We see that postnasal drip and just the fatigue that goes along with that. All that inflammatory reaction makes you super tired. Allergic rhinitis or seasonal allergies, hay fever, is super common. Affects about 10 to 30% of children and adults in the United States, and it is increasing more and more in our urban areas. Over the past 20 years, food and skin allergies have significantly increased in our kiddos. Talking about economic burden, about costs for us all, seasonal allergies, allergic rhinitis, often is associated with a lot of expense. Over-the-counter medications get to be quite costly. The missed work days end up pretty costly too. Overall, in our clinic visits, it accounts for about 2.5% of all clinician visits. Ends up with about 2 million lost school days for kiddos during the year, 6 million lost work days for adults, and about 28 million restricted work days, so not being able to complete a complete work schedule. Allergies are the 6th leading cause of chronic illness in the United States, and overall total cost burden is about $18 billion in the United States. Asthma is the result of that chronic irritation causing that airway restriction. Affects more than 24 million people in the United States and more than 6 million children. A lot of times, if we can really buckle down and treat the allergic symptoms, the seasonal allergies, we can really prevent the severity of asthma. Going back to symptoms, and so everybody knows our common ones. So those are our watery eyes, our itchy nose and palate, our runny nose, nasal congestion, sneezing. We have that postnasal drip, which is super obnoxious, and then the fatigue that goes with that. Some things that can be overlooked and not really attributed to allergies all the time is repeat cases of middle ear infections, repeat respiratory infections, especially ones without fever. Many cases of migraine headaches can be caused due to allergy exacerbations. Then you're more uncommon the dizziness, the ringing in the ears, hearing loss, and then that chronic postnasal drip. So always having to clear your throat, always having to just that dry, naggy cough constantly. Going back to fatigue, definitely can be related to allergies, especially if any of the above symptoms are related. Some of our snoring and sleep apnea can be improved with treating our allergies as well. Here's some kiddo pictures just to kind of give you an idea of what those look like in real life. We'll see our nasal salute or our allergic salute where kids are pushing up against their nose. We'll get that crease in the tip of the nose. Our allergic shiners or those dark circles under the eyes often are related to allergies. And then our Denny's lines. So you see those lines underneath the eyes just because of the inflammation created. All right, diagnosis is super common in any treatment process, obviously. Typically when we're talking about diagnosing seasonal allergies or allergic rhinitis, that is done by a clinical picture most often. Allergy testing, though, can really help us confirm or rule out allergies and then just kind of dial in what is causing that reaction. Correct diagnosis, counseling, and avoidance advice is based on our allergy testing. It helps reduce the incidence of our symptoms, need for medication, and overall, we're just trying to improve quality of life. For our allergy testing, there's two different ways to look at an IgE reaction. So you can do a skin prick test, which is what you think of your most common allergy testing. There also are blood testings that can be done. Now, skin prick test is a lot more accurate for our environmental allergies. Blood testing is better for our food allergies. There are different programs, there are different ways you can do skin prick testing for food allergies or blood testing for environmental allergies. But what we found in our practice specifically, we get better results and better treatment with doing the skin prick for our environmental allergies and our blood testing for our food allergies. Different ways to look at treatment. Treatment is always going to start with trying to avoid that allergen or exposure, especially when we're talking about pet danders. We can really reduce down the exposure that we're getting. There's different environmental things we can change. Talking about immunotherapy, there are several different ways we can work with that too. So we're talking about allergy shots or drops. And then something our clinic also offers is low-dose immunotherapy. And we'll get to that in a little bit. We have our traditional medicine treatments, our antihistamines, our steroids, our decongestants. Then we have different supplements that can help the body work in this best way. Looking at ways to reduce our allergen exposures, first we're trying to treat the air around us. So important, one of those aspects is doing air filtering. If we're not having any specific HEPA filtering, negative ion generators, we really want to change out our central heat and air filters every 1 to 2 months. Just keep that air circulating as clean as we can. And when we're talking about specific HEPA filters, those are usually standalone units that plug in that can treat, just depending on the unit, as many square feet as it can reach. These are most common in the areas we spend the most time, and so we'll usually recommend either in a living room that's close to a bedroom or bedrooms themselves, because we spend more time sleeping in our bedrooms than probably any other place of our house. Houseplants can also be helpful. They can help remove just dirty formaldehyde from the air. There's Boston ferns, there's dwarf date palms, there's also spider plants are also good at removing carbon monoxide. Now, this wouldn't be your first way to start your allergy treatment, but every little bit always helps. You can always do some mold testing in the house if molds are what's coming back as high in allergic range. Obviously, we want to keep our pets out of our bedrooms as much as we can, especially if they're high shedders. Especially for our seasonal people, we like to keep dust covers on our pillows and mattresses. And then obviously just keeping the house as clean as we can with frequent vacuuming and dusting. Looking at nasal hygiene, a lot of times we'll use either your neti pot or your saline nasal rinses. This can really help to just keep the inside of those nasal passages, to keep those sinuses nice and clean. Kind of think of it as you would shower if you were outside in the dirt all day. This is kind of a shower for the inside of those sinuses. When we're talking about a sinus rinse, you can do that up to 3 to 5 times a day. just warm saline water. That you have specific packets that you can get to do these to just make it nice and easy. Or typically it's about 1/8 of a teaspoon of non-iodized salt for about 8 ounces of water. You can also use your humidification, especially when those symptoms are ramped up. Hot baths and steam showers, so adding some eucalyptus or some peppermint and tea tree oil in there also can be helpful. But what we're just trying to do is help keep those mucous membranes cleared off so they can heal and just reduce inflammation. Traditional medications that we're looking at, you have your antihistamines. That's your typical Zyrtec, Claritin, Allegra, Xyzal, Benadryl. You have your decongestants for when symptoms are more flared. And then for major reactions, we have our steroids. So we start with lowest potency possible and increase up as we would need to. But the goal is, especially in functional medicine, is to get that body to desensitize, get that body to calm down, so we're not having to reach for these as much. Okay, so looking at more of our skin prick testing and treatment here. When we're using skin prick testing, it goes into that subcutaneous area of the skin. We inject a little bit of a antigen to create a reaction. And so small amounts of the allergen are introduced into the dermis and epidermis to just get to see what kind of reaction we're going to see. This provides us information about specific reactions to antigens in those allergens. The allergens are reacting to these specific IgE-bound mast cells, and that's what's creating our typical wheal and flare. So that's what we'll see, that red raised bump. Discomfort is definitely there, especially if you're having major symptoms, major reactions. It's itchy. That skin reacts just the same as it would if you were introduced in daily life. It's definitely not a pain-free look, but it's more of the itching. It's not necessarily pain with the injections. We have to be careful on who we want to do skin prick testing on, so who we want to do these subcutaneous evaluations on. Skin reactions are often really hard to tell in our very young population and our very old population. Just because the skin doesn't react quite in the same way. With our young kiddos, we just don't have the surface area that we need to. So typically we don't recommend doing any skin prick testing below the age of 2. Is kind of a hard limit. Typically we're trying to restrict that to closer to 4 to 5 in the clinic, just because of subject cooperation and just getting that better surface area. Obviously the specific case makes those differences, but that's just kind of general rule of thumb. Our elderly patients don't have quite as much like cushion under the skin, and so again, it just doesn't have as much of that ability to react as well. Contraindications for doing skin prick testing: we definitely don't want to do someone who has a bad skin condition. So if they have unmanaged psoriasis or bad eczema patches, you wouldn't want to do testing over this site, because obviously it's not going to give you that reaction that we want to see. Some people have what you would call dermatographism as well, and so that would be something, just that extra reactive, extra sensitive skin. And so with those antigens into the system, we'll just see a big clump of red swelling. We won't see that we can tell each individual antigen itself. We talked a little bit about need to have good subject cooperation, because it is a process, it is itchy, and you do have to hold still for a good 15-20 minutes to see that reaction happen. Another reason that we wouldn't want to do skin prick testing is if the patient wasn't able to come off of their antihistamine. So if our allergies are bad enough that we're doing a daily antihistamine, and coming off of that for a week prior to testing would cause significant reactions or just significant misery, honestly, we wouldn't want to do our traditional skin prick testing and SCIT treatment for them. We'll talk about some LDI treatment in a little bit, and that's a different option. But also, if we have a patient that has very unstable asthma or is using their albuterol inhaler multiple times a day on maintenance medication, still not having good control, we wouldn't want to do it in these patients either. Pregnancy is also a relative contraindication. The risk of anaphylaxis with our allergy testing is so small, but again, we don't want to rock the boat in these patients. And then patients on beta blockers. Beta blockers we're not able to do testing in these patients because their reactions, again, are just not the same. This is kind of what our skin prick testing looks like. And so we start with this multi-test device. That's that second picture from the left. These will sit in little wells of antigens. And so each different set will be a different set of antigens. And so we'll have pollens, we'll have molds, we'll have pet danders, we'll have grasses, we'll have trees. Each one that our allergy nurse knows this lines up with these reactions, and that gives us a way to test 8 different things with one prick versus having to do all individually. Once we get those initial reactions off of the back, we move on to intradermal testing on the arm to further dial in those reactions, further dial in for our dosing. But that's what that looks like on this third and fourth picture. So you can do it on the forearm, you can do it on the back of the upper arm. Typically, we use the back of the upper arm just because it gives us a little bit more surface area. But that's how we dial in these dosings for where we would start treatment. After the testing, it does cause some itching, so we'll put some topical creams on. We can use some hydrocortisone cream. We'll use some Benadryl cream just to help reduce that itching. Ice can help just because it slows that inflammatory response. You can take an oral antihistamine at that time, especially if the itching's severe, so Benadryl or Zyrtec or Claritin. Typically, once that testing is done, the itching is done after about 15 or 20 minutes. We always tell our patients too, you can have a late reaction. It's not super common with our skin prick testing. However, our molds can have a later reaction. So that's one of the things we want to watch for. Sometimes that's more of a delayed look. Typically, we'll hold on to our patients for about 30-40 minutes after, just to make sure that they're not going to have any type of reaction. Just want to, anytime we're trying to provoke that immune system, we have that chance of an asthma flare or an anaphylactic flare. And so we just like to be careful and make sure our patients are safe. All right, so looking at shots and drops, that's our typical immunotherapy. Immunotherapy has been around for over 100 years. It's kind of our tried and true. It's the only potential cure for environmental allergies because it's working towards an immunologic tolerance. So by starting with small doses and building up, we can get that immune system to start to recognize this antigen, this allergen, as not as harmful, and so we don't see those big inflammatory reactions. So we don't see that big asthma flare, that big sneezing fit happen. When we can adjust that immunologic tolerance, this means preventing the development and progression of asthma in our children with their allergy symptoms, and by managing the immune response and hopefully preventing new reactions from happening. Immunotherapy is something we always want to watch, especially if our symptoms are nagging. If they happen every spring and fall, if they're happening all of the seasons, we want to be able to give the most relief over time. So if someone has not been able to control their triggers by the occasional Benadryl or Zyrtec or Claritin for a couple weeks, these are our patients that we want to look into, especially our patients that have multiple sinus infections a year or multiple trips to the doctor just with questioning if it's allergies or a sinus infection. The typical cost of over-the-counter or prescription medications is more than immunotherapy in the long run. So if you think about a $20 bottle of Zyrtec every month versus treatment with immunotherapy, a lot of times those medications are going to cost you more than shots and drops. Typically when we're thinking about treatments will last 2 to 5 years to get the maximum benefit. Sometimes we'll start seeing symptoms improve in as little as a few months. But to really get that immune system to calm down, to really get that immune system to reset, we have to be in it for the long haul. So if we're wanting quick fixes, shots and drops is not going to be that treatment option. Really, we're going to need that long-term treatment to get that immune system reset. Again, immunotherapy is repeated increasing doses of either shots or drops of specific antigens for the patient. And so based on your skin prick testing, we would take those specific reactions and dose the allergy vials for you. This is, with the goal of reducing that inflammatory response, decreasing sensitivity, and hopefully that results in fewer or no symptoms at all. Immunotherapy is conducted in 2 phases. Typically, we'll start with those largest reactions have the smallest amount of antigen in our vials, and so we'll have this updosing phase. So we're getting that body small doses to start with, and as we're tolerating, build up until we get to more of a maintenance or concentrate dosing. Typically, our updosing lasts about 6 months to 2 years. It really just depends on the patient, though. So it really just depends how the patient is reacting. Some of our patients take a whole lot longer to dose up, a whole lot longer to desensitize than others. Some are super quick and just really hit every escalation dose that they should. And the maintenance phase is going to be at least a year to possibly 3 years. There's a cool study showing that the effects of immunotherapy. So after 3 years of getting the specific allergy antigen shots drops, the clinical effects lasted up to 6 years. It looked about the same in patients who were continuing to get the same customized shots drops as those who were receiving a placebo injection. And so really 3 years is going to be a good length of treatment to get that immune system to calm down. So we talk about our SCIT versus SLIT. So that's our lingo in the office. So SCIT is going to be your subcutaneous immunotherapy, and our SLIT is going to be our sublingual immunotherapy. So subcutaneous meaning allergy shot, so under the skin. Our allergy shots, a lot of our insurance plans will cover these options for our patients. Every insurance plan is going to be a little bit different. So some of them are great at covering the cost of testing, while some of them are great at covering the cost of shots, or some of them are great at covering both. Some of them are not good at covering either. It just really depends on that insurance plan. So we always start with that. We'll always reach out and say, hey, this is going to be cost-wise before we get you going in here. When we talk about allergy shots, those are given every 7 to 14 days. They can cause a little local reaction at the injection site. And again, that's going to be patient specific too. Some people are a little more reactive than others, but you can have a little red wheel on the injection site as well. Our allergy shots have to be given in the office at least until we're at concentrate, until we at least know what that reaction is going to be, just because there is a small concern for an anaphylactic reaction. Super uncommon, not something that we see happen often, if ever, but it's one of those safety things that we just want to make sure our treatments cause no harm. Every time we start a new vial with our allergy shots, we do test that for safety, just to make sure that 100% that we prepared this correctly and you're going to respond to this correctly. And so it just is a little bit more face-to-face with allergy shots than it is with drops. Our sublingual drops are not insurance covered. They are not an FDA approved option at this point. They've been in treatment since the 80s, so they've been around for a very long time and honestly have really good efficacy too. If we can stay consistent with either treatment, we usually have pretty similar response. The difference between our allergy drops is they are given under the tongue. These can be given at home, even though we watch you take that first dose. We want to make sure that first dose is not going to cause a reaction. But with the sublingual drops, there's no documented cases of anaphylaxis with this to date. And so just a little bit a safer option. LDI. And so this is one that's not your typical allergy shots, drops treatment, not your typical immunotherapy, but could really be a good option. So low dose immunotherapy is not going to be a customized panel. It is based on the where we're at. And so it would be the most common tree, grass, pollen, pet dander reactions, and those are blended into a very diluted drop set. So these also go under the tongue. But they're not performed like either one. So when we're talking about LDI is typically dosed once a week until we can get to where that good dose is at. So once we can figure out where we can have the best relief without causing a flare, that was what we would consider a maintenance dose. Once we hit a maintenance dose, we're giving these drops every 7 to 8 weeks. Still the very same concept as doing our allergy shots or drops. We're trying to get that immune system to calm down, basically. We're trying to get that immune system to not create such a huge reaction when it's introduced to a certain antigen, or panel of antigens. LDI is a great option for someone who cannot come off of their antihistamines. And so for someone who is just super struggling, just antihistamines are how they get through daily life, this is an option to try to get that started. So the goal is again, get that immune system to calm down to where they can come off of their antihistamines. If they're not getting great relief with LDI, then we could move on to customized therapy with the allergy shots, drops, so SLIT versus SCIT there. LDI, again, is that group of common antigens, and we're treating through dilutions as well. Different panels that we have available are environmental. So that has your pollens, your molds, your danders. We do have some food panels or chemical panels that we can use for treatment as well for desensitization. Yeah, if you guys have any questions about that, let me know. Moving on to more supplemental look. And so when we're talking about supplements, we are trying to help boost that immune system. We're trying to help boost that our body to do what it needs to do to handle it itself. So we have different nasal sprays we can look at. There's different compounded nasal sprays. So BTX is what we'll use for a more longer term infection. This probably wasn't the greatest one to be our first example just because it's not our first go-to for options. But BTIX, it works as an antibiotic, as the bacitracin. Triamcinolone is a steroid. Itraconazole is an antifungal. And xylitol, it helps make that solution hypertonic. It helps protect those mucous membranes. And so as a combination, it can be a really good topical option for more of those lingering, long-lasting symptoms. Xlear is a good option for a nasal spray. It's kind of that next step up after a saline nasal spray. Xylitol helps make that solution hypertonic, and so why that works is with that hypertonic solution, it helps pull fluid from that sinus tissue, and so it reduces swelling. And so it's a nice way to reduce swelling without having to use steroids. The xylitol also helps protect a good barrier in the sinuses as well, and so it helps just moisturize and protect that delicate sinus tissue. Quercetin is a supplement we'll jump to quite a bit to help decrease reactions. Quercetin is a dietary polyphenol. It's a very potent flavonoid. It has great antioxidant and anti-inflammatory properties. It is super important for our allergy responses because it does work on the mast cells and our basophils. And so that helps us stabilize that histamine response. If we can get those mast cells to calm down, we don't see that big histamine dump. And so when we see that histamine dump, that's your sneezing, your runny nose, your watery eyes, all that allergic reaction there. There has been evidence that shows that vitamin C and quercetin work really well together. And so it gives them more of a synergistic action. It helps the vitamin C helps recycle that quercetin, so it just increases the efficacy of both. Quercetin has a potential to reduce the most significant pathologies of asthma because again, it works on those white blood cells, and so it makes the reaction lessen, and so it decreases that mucus production and airway hyperactivity. Quercetin can also suppress production of different eosinophil looks. Again, just another way it's helping work against that allergic rhinitis look. Vitamin C is a natural antihistamine and antioxidant. It's proven to decrease inflammation and swelling at the site of allergic reaction. And overall, it's just helping boost that immune system. And so that quercetin vitamin C combo can be really, really helpful at just boosting that immune system and squashing that inflammatory reaction. One of our products that we use a whole bunch is our product called Allergy Support and then Dehist. A cool thing, Dehist does make a kid version, and so it is chewable. So you can treat kiddos 2 and up with more of the supplemental approach as well. Dehist or Aller Support, we like to compare more to our Zyrtec and Allegra. Both of these products have quercetin, they have bromelain, they have stinging nettle in them, and some acetylcysteine. So again, stabilizing those mast cells, helping squash that inflammatory reaction with the bromelain and the stinging nettle. And then acetylcysteine acts as a mucolytic, so it helps break up that mucus, helps protect that airway lining. Anytime we're working with supplements, anytime we're working with even antihistamines in general, we're trying to get that loaded into the system before those flares start happening to get our best results. When we think of our supplemental approaches, it needs to be more of a daily look. It's not necessarily a spot treatment. And so it has to be built up in the system. It has to be working already before we get that introduction of the allergen and potential response there to get our best results. Some of our patients are super responsive to histamine in general. A lot of times we'll see these as our seasonal allergy and our food reactive patients. This is a different probiotic supplement that can be helpful for people sensitive to histamine. It doesn't contain inulin, and so those who are sensitive to prebiotics and carbs don't have quite the reaction. It does have specific probiotic species that have been carefully picked that don't cause an increase of histamine in the gut. Our other few that can be really helpful for our reactions as well. Again, N-acetylcysteine acts as a mucolytic. So it helps break up the mucus, helps it get it moving along and protecting those respiratory pathways. Black seed oil is also helpful for anti-inflammatory properties as well. You can take it orally or intranasally. And one study showed about 92% of patients in the study decreased their symptoms or were symptom-free. So pretty good results there. Fish oils also, just because of their anti-inflammatory properties, are helpful for anything reactive in general. So anti-inflammatory, allergic rhinitis, all those good things. Fish oils are great. Helps protect the vascular system. But typically when we're dosing more for an anti-inflammatory look, we're going at least 2 grams a day. And so that combination of EPA and DHA needs to be at least 2 grams to get that good benefits there. Vitamin D is going to be important in anything that's related to the immune system, just to help boost that immune system response. Typically when we're looking on blood levels, we want this to be at least 50 to 80 on blood testing to get the good response, even though your typical cutoff for a normal vitamin D level is 30. Most patients do really well with about 5,000 IUs a day or 50,000 IUs once a week. And in those, typically the daily versus the 5,000 daily versus the 50,000 IUs weekly gives us about the same results on blood testing. Oh, I see, got a question here. What are the ingredients in the shot other than the antigen? Samantha, are you talking about more of like traditional allergy shots? Is that right? I think that's what you're meaning there. In our shots, other than the antigens themselves, they're mixed with glycerin. Most people do really well with glycerin. We do have a few patients that are sensitive, and so there's different ways we can mix that. But for the most part, our allergy shots are mixed with glycerin. There are other foods that can be more as that natural decongestant, more of that overall anti-inflammatory. So our hot peppers can be helpful for a natural decongestant as they open up those nasal passages. Raw honey that's locally produced is in theory is helpful to introduce more of those reactions. Or I'm sorry, and that raw honey, I was looking at the comments. But raw honey, with the bees getting pollen from our local plants, can introduce those pollens to the system in small doses too, and be more desensitizing. With honey specifically, you do have to do it daily, just as you would with other treatments, just to get that good effects. All right, that's about all I have for you guys this morning. If there's any questions, I'd be more than happy to answer them. I see, can a preteen take quercetin and how much? Yes, absolutely. A preteen can take quercetin. Um, Typically, really it just depends on the preteen. And so if they're small in size, I'd go more off of kid dosing. If they're 100 pounds, we could go off adult dosing. Typically, it's about 50 milligrams. But again, I like the combination products with like DHIST or Aller support, just because it gives a more rounded effect for these reactions. Quercetin in itself is great; it absolutely is great. But I typically go more for the combination products just to get the anti-inflammatory and the mast cell stabilization. All right, guys. If I'm not getting any more questions, I will hang out for a little bit and just see if any more questions come through. If you guys want to add them on to the video later, I'll definitely get back to you on these. Um, but yeah, hope everybody has a good morning. Hope we learned a little bit this morning about allergies and ways we can treat them. Um, but feel free to shoot me a message on Facebook, or be happy to see you in the office, give you more individualized answers there too. Um, but yeah, hope everybody has a great Saturday and hope to see you soon.